Well, Herb Lawrence with the Arkansas State University Small Business Technology Development Center. And I'm sitting here today with Brad Hyde. Brad is a marketing professional with an area healthcare service, and I'll let him explain that. And we're talking a little bit about how marketing for health professionals in 2012 has really changed. So, Brad, tell us a little bit about yourself and your background.
Well, I'm a graduate of Arkansas State University, and I have a degree in journalism with an emphasis in public relations. And my entire adult career has been in healthcare marketing. And one of the focuses that I've seen in that, I consider it a long career, but of course, you know, who wouldn't consider their own career a long career? But in my long career, I've seen a tremendous change in how you approach your referrals and those people that would send patients to your facility through healthcare.
Well, tell me a little bit, Brad. And who do you work? Where do you work right now?
I work for Delta Medical Center of Memphis. We are a we're a medical surgical hospital with 90 psychiatric beds, and mostly my focus in the past has been with the behavioral health services. But since I have recently become the social media administrator, my process has expanded so that I include all of the services of the facility.
Well, and that brings up something really interesting. Your title is Social Media Administrator for a healthcare organization. I know a lot of people in the healthcare medical professional industry have some real concerns about exactly getting into this social media thing because of certain laws. What's your take on HIPAA and what they need to be thinking about?
Well, that's a good point because probably besides treating people well and getting them healthy, the next biggest concern of a healthcare provider is to properly keep someone's confidentiality, and there are quite extensive laws that say what we can and cannot do, and HIPAA does scare people when it comes to marketing and social media. In fact, I'll give you a little tip. 9 times out of 10, if you see any kind of marketing that a healthcare provider is doing, and there are individuals in that picture, in those pictures or in those images, they'll be employees of the hospital. I've never known someone to stick a patient in just because of HIPAA and things like that, and getting approval, and it's just really hard. But my feeling is that HIPAA, the guidelines give you a wonderful path in how you can provide information to people in a proper way, as long as you are aware of how the HIPAA rules work and be very cognitive of your audience. And so you can get around those things. You can provide information easily to someone without violating any HIPAA regulations.
Correct. Well, thank you, Brad. And if you are watching this and you are in the healthcare profession, medical professionals, wanting to learn more about your online marketing opportunities, the good news is the ASU Small Business and Technology Development Center will be co-hosting a day-long training workshop series on Tuesday, October the 30th, here at the ASU Delta Center, called Online Marketing for Health Professionals. We'll be breaking it into about 3 different sections, talking about website design, how to capture your local market, and fundamentals of how to use social media, as well as a panel discussion with more details about HIPAA. Brad, thank you very much, and I know we'll see you there because you're going to be one of our speakers.
Thanks, Herb.